As we know, Ghana was declared polio-free in 2015, and then we've been quiet until last year, somewhere July, when we started having environmental samples testing positive for circulating vaccine-derived polio. And then later, just a couple of weeks after, we had a child in the northern part of Ghana who also tested positive. What it meant was that then we had to actually intervene and do what we call the response, polio response.
So this particular polio vaccine was imported from Belgium, and UNICEF supply division supported with the procurement and the shipment to Accra. So at the national level, when the vaccine hits the airport, the national team have to make an arrangement with a cold van to go to the airport to pick the vaccine. And the vaccine has to be maintained in a controlled temperature range of +2 to +8. And that temperature should be maintained from the regional level to the district level and to the volunteers. When the vaccine gets to the regional cold room, they also make their own internal arrangement for districts to come to the cold room to pick their allocations. At the district level, they also distribute this vaccine to the sub-district facilities and health centers, where volunteers get access to the vaccines and use them in the field.
We train about what a vaccine looks like, how it has to be given, the potential or possible adverse events, finger marking, house marking. We go through all the tools, how the tools will have to be used, the tallying, the skill in tallying, how many volunteers are involved. And so we do a lot.
If there is no collaboration in this response, we fail. That's why the collaboration is very important. The collaboration, how? We are planning together. We are mobilizing funds together. Even in the field, we are together.
We meet very regularly to plan, investigate the cases, follow up, use the data. Who is where do we need more people? And constantly we are making these decisions and making sure that things move on very well.
I think bringing the partners together, we have one common framework that we are working towards. And in that regard, it also limits the wastage of resources. Every agency is pulling together their resources to ensure that Ghana is able to meet the standards that is expected globally.
We had the district information van going around giving announcements about the exercise. We were also supported by UNICEF to send volunteers to go house to house and educate the people, announce to the people the date for the exercise and what they are supposed to do. Women are the key people involved in this exercise because they nurse their children. And so it is good that we have women being the volunteers. And notwithstanding, we still need the men. There are certain areas you need men, strong men, to be able to get to the community.
We are highly ready for the exercise, and you can even see the way the volunteers are interacting, they are responding. So we are very sure that they will be able to give us the best result that we want.
Now we are almost at a standstill now. We don't know what to do. It's difficult at first. So let's see.
We are here today in partnership with UNICEF so that we reach children that we could not reach in 2019. We are very grateful for the partnership, and it is exciting to see the children here having been dosed already by our staff.
This particular sub-district had 2 teams that were doing vaccination with a target of 340 children. And at this time, which is 3 p.m., they've been able to reach 333 children. They've done very well.
It is a hard-to-reach community. It took us a few hours by road and then 1 hour by boat to reach this community. We're very pleased to work in partnership with the Ghana Health Service, as well as the Ministry of Health, WHO, as well as CDC. And we want to thank also Bill and Melinda Gates Foundation, Gavi and other partners for the team efforts, because we need to reach every child.